Breast cancer is the most common cancer in women and the leading cause of cancer-related deaths in Nigeria. As part of efforts to promote awareness about the disease, the World Health Organization designated every October as Cancer Awareness Month. As we round off this month, Just Nigeria's Mercy Frank speaks to survivors of breast cancer and seeks expert opinion on what must be done to further reduce its prevalence in Nigeria.
Breast cancer, a silent foe, testing the strength of its victims. But many are fighting back, surviving, thriving against all odds.
Now I talk about it openly that I don't have breasts. I have breasts, I paid for them, I take them off when I want to, but I've come to realize that life actually is more important.
However, not everyone wins the battle.
We should have listened. Had even we listened, I believe maybe by now she would still be alive.
Of the 32,000 women who were diagnosed with breast cancer 2 years ago, about 15% of them died.
A 2024 data from the World Health Organization shows that breast cancer caused 670,000 deaths globally in 2022. According to the WHO's International Agency for Research on Cancer, Nigeria has the third highest age-standardized breast cancer incidence rates in Africa. Each of these numbers represents women like 60-year-old Abigail Simon Hart.
No English doctor invites you to his house on his day off if it's not something terrible. He said, the bad news is you have breast cancer. The good news is we got it early. And I just said, take them off. And he was like, you haven't even, I said, just take them off. How quickly can I take the breast off? And I don't remember anything else of that conversation. That's one thing when you get the cancer diagnosis, your world stops.
Abigail says beating breast cancer medically is only one part of the difficult journey.
I did lose some friends along the way. There is nothing, forget about it. I mean, cancer is a great clearer of your address book. I think the psychological part of cancer is something that really is a tough one. The depression, some people, the medication makes you feel unhappy. I was on hormonal treatment, my hormones were all over the place.
Among the casualties of breast cancer are family members like Gift Andrew, who sometimes helplessly watch their loved ones slip away. Gift's wife, Grace Andrew, was diagnosed barely a year after their wedding and shortly after the birth of their child.
Discovered that as the pregnancy was growing, the lump was also growing. When she gave birth, we discovered that that lump was now bigger. And she needed to breastfeed this baby. But she couldn't really proceed because she was having some pains on her breast. So we told her to go back to the hospital. We got there. They broke the news to us that actually the sample shows that the lump in there was cancerous.
Gift says he regrets the influence of what he describes as misguided religious beliefs in seeking treatment for his late wife.
They advised her not to go for the chemotherapy, changed her mind and decided to go to pray. She kept on praying. None of them cured her.
Breast cancer refers to an abnormal growth within the breast.
Breast cancer, like any other cancers, don't have a particular identifiable cause, right? But there are risk factors that are associated with the occurrence of malignancies.
Some symptoms women may present with are an ulcer on the nipple, like it heals, then it goes away, comes back. So a nipple ulcer, nipple discharge, which may be bloody. Change in nipple position, where there's this orange peel appearance in some part of the breast, or the pores appear more pronounced.
But they can also be broadly divided into the genetic risk factors, the environmental risk factors, the hormonal risk factors, and we mentioned environment and other risk factors.
Doctors say breast cancer, though serious, is treatable if detected early. This is where self-breast examination plays a critical role.
Now, when you want to examine, then you put your hand on the upper outer region and just gently rub that region. With that way, you can feel if there's any lump in the breast, you can feel the consistency of the tissues, and you can know if there's any pain in that region. Now, you do that upper outer region, you go to the lower outer region, the lower inner region, and the upper inner region. Another region that you might want to examine is across the nipple and the areolar space. So you just press directly on that nipple areolar complex and you feel that too. So the last region you want to check in the breast examination is the armpit.
So, how can one tell the difference between lumps?
You can't tell the difference if you do not go to see a doctor who will do the triple assessment of examining your breasts.
The journey through breast cancer treatment can be physically demanding, but doctors say these make a huge difference between life and death.
The treatment modalities that we have are surgery, like chemotherapy, radiotherapy, and some will add immunotherapy.
We want to remove the breast lump. But if the lump is too big, then we want to remove the breast. So we're talking about life.
From the initial shock of diagnosis to the rigorous treatment regimen, experts say patients face a multitude of emotional and psychological challenges that are often overlooked.
So the person now is receiving treatment for cancer, but internally, mentally, the person has a big struggle with the emotional challenge that comes with it. This is where psychotherapy comes in to help.
Unfortunately, many cancer patients don't get to see a psychotherapist.
In fact, many medical practitioners would consider some of the emotional challenges that patients go through as just one of those experiences that are normal for patients receiving cancer to experience.
Doctors here at the NSIA Luth Cancer Center tell me that 40 to 50% of the patients they see are battling with breast cancer. Well, statistics from the Cancer Society of Nigeria indicates that as the incidences are high, so is the mortality rate, owing to major misconceptions and myths around breast cancer.
It's not been scientifically documented that when a type BRCA can cause breast cancer. However, the breast as an organ needs to breathe.
Well, I've had to work with some people who are in their 20s.
Yes, but the percentage of the women far outweighed that of the men.
If there is a persistency and the consistency of the lump is hard and nodular, right, then you should see your doctor.
The number one risk factor in breast cancer is being a female.
When people are diagnosed with cancer, it has nothing to do with faith.
A lot of our cancer patients who relatives don't particularly want to accompany to the hospital because they believe that when they accompany them to the hospital, they might come down with the same ailments, which is very painful.
As Nigeria joins the rest of the world to commemorate Breast Cancer Awareness in October, breast cancer champions like Abigail Simon Hart and Gift Andrew want everyone to offer support in whatever capacity they can so that no one should face breast cancer alone. Mercy Frank, Gist Nigeria.
Indeed, early detection saves lives. Do you have a personal cancer survival experience that you would like to share with us? Tweet us on X at Gist Nigeria TV. We would like to hear from you.